Hello, I'm Dr. Larry Carnes, and welcome to Books of the Month. We're so glad that you could join us for another powerful and exciting program. And we have a very special guest with us, Dr. Richard Van Buskirk. Optimum blessings to you, sir. How are you today?
Very good, thank you.
And please introduce this lovely lady sitting beside you.
Yes, this is my wife, Monica.
Tell our viewing audience a little bit about yourself.
Okay, I started medical school late. I was 36 at the time, but before that, I had a PhD in neuroscience from Duke University and taught physiology. And then I decided wanted to become a physician. So I was teaching in an osteopathic school. Fell in love with the osteopathic concept and decided to become a student of osteopathy. And today, I'm still a student of osteopathy 40 years later.
That's amazing. You've written this fascinating manual, Steel Techniques Manual Applications of a Rediscovered Technique of Andrew Taylor Steele, MD. Speak to us about this powerful book that you've written.
Okay, the Andrew Taylor Steele was the founder of the osteopathic profession, which today produces about a third of all new medical students in the United States. But for a long time, we've been a minority profession, homegrown, unlike the MD, which came from Europe. We have always practiced medicine and surgery, but we're unique in two factors. One is that we used musculoskeletal manipulation in addition to medication and surgery and delivering babies. And the other was that we looked at the human being as a whole living entity, not pieces and parts.
That's amazing. That's powerful when you speak about that. I was looking here as doing some research. It says the book includes an analysis of this unique manual medicine approach, and it was first discovered, taught, and used over 140 years ago. That's amazing to me. Give us some information about that and speak to our viewing audience about that technique.
Right. So the technique was probably the original osteopathic technique, but Dr. Still did not feel that osteopathy should be defined by a technique. So he allowed the development of a number of them. But in the process, his technique, which was harder to teach, got lost. By the time he died, it was not in much use. I rediscovered it in looking through some of the old books and found it to be very fast, efficient, simple in execution, but requiring a high knowledge of anatomy, and painless, which is nice.
Yes, painless. So when you speak about it being painless, I noticed here that you said you did rediscover it. What led you on this quest to rediscover, and then I'm going to use the word, if it's appropriate, to begin to perfect this method that you dedicated your life to?
Originally, I found the technique to be remarkably efficient and well received by my patients, who were very patient with my attempts to apply it.
Take the pain.
And my patients would come to me with many different problems, but included in all cases were musculoskeletal restriction and pain.
Yeah.
And the technique I felt needed to be brought back because it was different from much of the other techniques that were being used. One that was common is very similar to what the chiropractors use. Others had been developed over the years, were powerful but not necessarily painless, or they took a long time to perform.
Oh, to get the results. And so by you rediscovering the technique that Dr. Steele had, you find that you're getting more rapid results and it's painless, and you're finding that your patients are really benefiting from the techniques that you're using.
Absolutely.
I heard you say that there are not many who are practicing this field, and it's because it's very difficult. For one thing, just by listening to you can tell that it's difficult. So now, what is it that makes it so difficult, and what makes it so challenging? And then share with us, please, what are some of the implications that people are suffering from this musculoskeletal deficiencies?
So one of the problems with the way many practitioners who do musculoskeletal medicine practice is that they do not focus on an anatomical definition. So if you have a pain in the neck, they will treat the neck, but not necessarily determine exactly what was wrong. It would be as if a surgeon, in order to treat the stomach, just opened the whole stomach and then decided what needed to be worked on. It might work, but it's not as exact and efficient. So the still technique focuses on everything from headaches and neck pain, back pain, restrictions in motion in the shoulder. If you got a frozen shoulder, we can treat that. If you have pain in the shoulder that's not surgical, you can treat it, relieve it without needles, without surgery.
Now that speaks volumes.
And so many people have back pain, or their backs have been operated on and they haven't got results. And Richard takes those situations and turns them around. They're not perfect, but he helps.
Yes, yes. They're not enduring the suffering and the pain that they were enduring prior to.
Right.
Right.
That speaks volumes. There are people who are going to be watching this interview. They're going to be watching this, and they need to find some relief because they're suffering from some of those things that you're talking about.
Right. And that's where those osteopaths who practice manipulative medicine have an advantage over, say, the average MD.
Yes.
Because we can do more than throw pills at it or needles.
That's the very thing that just came to mind. The practices that many are involved in simply mask, but people never get any long-term relief or cure to what they're enduring and going through. And if I'm hearing you correctly, there are going to be some long-term, sustainable, positive results.
Correct.
When they're treated. Oh, this is so powerful, so powerful. It's amazing. I want you to do something for us. And if you would, let's take the time, because we want to make sure that this information gets out. Please share with our viewing audience any contact information, be it website, email, any information that you want to disseminate, because people need this most valuable information.
So my practice website is buskirkosteopathic.com. And the website to purchase the book is Still Technique, vanbuskirk.com.
Yes. Give them your practice again.
Is vanbuskirkosteopathic.com.
And the information that you just disseminated, give that again.
Still Technique, vanbuskirk.com.
I think it's so very important that this information be disseminated. And when we want people to go and purchase this manual that's available there on Amazon, when they go and purchase this manual, what are going to be some of the nuggets that they're going to get from this manual that can be very beneficial to them?
Well, the manual includes how-to, not necessarily something that the average person should be trying on themselves.
Yes.
But it also gives them information about manual medicine and osteopathy, that both the history and the redevelopment, how it works, and maybe it'll help them encourage their doctors, whether MD or DO, to look at including this kind of medical practice in theirs.
Yes, to do some further research to become, I think one of the things is that there's a lack of education when it comes to new techniques.
Right.
And many have been socialized and modified under the old system, and they're very hesitant to be introduced to something new that's going to be sustainable and beneficial.
Right.
And if I might add, one of the reasons we wrote the next book was when they were reading this manual, people could look up the history why they had bad knees, bad shoulders, bad hips. And our editor felt very strongly that she used the book to help herself.
Well, that is amazing. That is so, so powerful. We have about 60 seconds left. Take 30 seconds and disseminate to our viewing audience any information that you want to give them before we leave.
Try to find either an osteopathic physician or an MD who is willing to incorporate manual medicine in their practice to help yourself. Because healing comes from you, not from the doctor.
My goodness. Healing comes from the individual, not from the doctor. That has to do with internal healing.
Correct.
That is so powerful. We want to thank you and your lovely wife for being our guest today. I want to encourage our viewing audience and those of you who may have been suffering, and maybe you have a family member who's suffering with some of these things. Make sure that you go to the information, go to the website, contact Fabulous Dr. Van Buskirk and get in touch with him. And make sure you get this manual. I'm Dr. Larry Carnes. We want to thank you so much for being with us. Remember to always out love, out serve, out forgive each other. Thank you so much for being our guest today.